Here at ONS 2010 in San Diego, Oncology.TV talking spirituality and cancer patients. And doing it with us is Tami Borneman from the City of Hope Cancer Center in Duarte, California. Thanks for being with us.
You're welcome.
Tami, how are most nurses prepared for dealing with addressing and understanding, identifying the spiritual needs of cancer patients?
They're not that well. It's not something that you get in school. It may be touched upon within psychological issues. There is no, unless you go to a Christian school or a faith-based school, you really don't get a lot of training in that area. And I used to volunteer as a chaplain on our BMT unit, and I had numerous nurses that would come up to me and say, I don't know how to handle this, I don't know what to say, I don't know what to do, can you go see this patient? Or they would come to me in tears and go, I really care about this patient, I don't know how to help them spiritually. So we don't get good training in school. So it's an issue because it is very much part of who the patient is, whether they claim to be, a Protestant, Catholic, or Buddhist, or whatever. We don't get the kind of training that we need to deal with those kinds of issues.
Okay, so it would seem the next logical question would be where? How do you get the training until somebody can get it? What are some of the resources that are available?
Well, there are numerous textbooks. There are many things online. ONS, Karen, whom you interviewed previously, is the current Spirituality Special Interest Group Coordinator. I was the past coordinator, and we have numerous resources through ONS, the Spirituality SIG. There are chaplains, usually chaplains within the institution that nurses and physicians can talk to. I'm not sure of groups that people can go to, but there are many resources out there that if you want to take the time to look, they are there. I just wish it was more cohesive.
How do healthcare professionals, especially nurses on the front line, how do they cope with doing this kind of work? To understand your question, how do I, as a clinician who provides spiritual care as part of my care, take care of myself?
I think it is realizing that if you put up a protective barrier and keep your arms length to everybody, you will burn out a whole lot faster than if you allow yourself to feel with and for patients and their family members, because you can't keep arm's distance forever. We're feeling human beings, and we're meant to care and love. And there are those people that you will get close to, and you grieve. You have to allow yourself to grieve. You can't hold it all in either. And just taking time away from your work, doing things that make you happy outside your work is a great way to take care of yourself. And remembering that you can only do the best you can do, and not going home with a lot of guilt where I should have, or should have done this or said that. I think if we treat people with respect and dignity and integrity, and just our presence a lot of times is all that they need.
Your work is more about love and compassion than religion, isn't it?
It is. I personally am a faith-based person, and when I encounter those of other faiths, I don't focus on the religion, I focus on you as a human being, because that's why you're here, and my caring about you as a human being is what's important to me, and I want you to get the best that I have to offer as a nurse.
Tami, thanks for sharing some of your expertise and some of your heart. You can tell your heart is really in this work.
You're very welcome. My pleasure.
Tami Borneman from the City of Hope Cancer Center in Duarte, California, here on Oncology.TV.